You have the cephalic vein. So it runs right there. Runs just under the deltoid muscle. And just around the just below the clavicus. That's your cephalic vein. Your pectoralis major. Okay. Pectoralis major or your major pec. That's the muscle mostly responsible for abduction of the arms, pulling your arms back into the midline. Your external obliques, your linea alba, that's the one that runs right dead center at the middle. The inguinal ligament, the umbilicus, the rectus sheath, which is the anterior layer, goes over the rectus abdominis muscles, the serratus anterior muscle, and the deltoid muscles. Okay, the deltoids are muscles of abduction. The pectoralis major is muscle of adduction. Okay, and a little bit deeper dissection of it, you have your sternocleidomastoid, where it attaches. Okay. You have your thoracoacromial artery. Okay, we haven't gone over the cardiovascular system yet. The deltoid muscle, cephalic vein, the medial pectoral nerve, your serratus anteriors along the side, the rectus abdominis. Okay. Those control your six-pack. Your internal oblique, the muscles at an angle there, and your ilioinguinal nerve that runs down the side. You have the pectoralis minor and the pectoralis major. Okay. The minor is a smaller muscle, sits lateral to it. The pectoralis major runs more medial and is a much larger muscle. You have your internal intercostal, which are between your ribs. Okay. Then you have your external obliques. Can you see the external obliques here and the internal obliques there? So your external obliques on the outside, internal obliques are more medial to them. And then you have the rectus sheath, which overlies the rectus abdominis muscle. Load up. Again, the pectoralis minor, pectoralis major. Okay. Latissimus dorsi was right along the edge of the side. The internal intercostal muscles from the ribs. The external intercostal muscles of the ribs. Okay. So the internal intercostals are medial, ones that connect directly to the sternum. And the external intercostals are the ribs that back around, going away from towards the vertebral column. Your external obliques and your internal obliques. Okay. Transversus abdominis muscle runs on the side of the rectus abdominis. And the rectus abdominis muscle, and that part has been cut away. Okay. It has been cut away and moved up. So here's where the rectus abdominis attaches, and it's been flipped upwards to get out of the way. Okay. Then the rectus sheath, that's your posterior layer. The rectus sheath, anterior layer. So there's your anterior layer and your posterior layer of it. That's been cut as it's been dissected out. Your ribs and costal cartilages, ribs 2 through 9. Your internal thoracic artery. Your serratus anterior muscles. And we covered the pectoralis major. And we'll let the computer catch up again. All right, that's your deltoid muscle. Again, the muscle on the outside over the pectoral girdle. The cephalic vein runs along there. The serratus anterior muscles on the side. This is your lateral view. This shows a good view of all the serratus anterior muscles. Latissimus dorsi. runs vertical. And then your external obliques. And you can't see the internal obliques here. This is your linea alba. That's the line that runs right down the middle. And then the umbilicus. And the rectus sheath anterior layer that lies over the rectus abdominis muscles. You see a pectoralis major. And underneath there on the side here would be a pectoralis minor. You can't see it. And there's your clavicle. Again, a little bit deeper section. You have your deltoid muscle. You have your pectoralis minor. Now you can see the minor where the pectoralis major is pulled away. The pectoralis minor is deep to it. Now you can see the pectoralis minor. Okay. The external intercostal muscles, the medial pectoral nerve, the internal intercostal muscles, your serratus anteriors, and your latissimus dorsi along the side there. You have your external obliques, okay, and you have your rectus abdominis. Okay, and you have your internal obliques. Again, so here is your external obliques. Make them line up. And then your internal obliques. Runs that direction there. The rectus sheath is still present. The linea alba, it's a line right down the middle. Pectoralis major, you can see a side view of it. Costal cartilage is ribs 1 through 5. And your clavicle. All right. Okay, posterior view. Again, you got your infraspinatus fascia. It covers over the infraspinatus muscle. Your rhomboid major. Okay, latissimus dorsi. See the huge muscle on the side. The external obliques. The iliac crest. That's the crest of the hip bone, the anterior portion, superior portion of it. The gluteus maximus, main muscle of the buttocks. The gluteus medius, it's the smaller muscle there above it, superior to it. Thoracolumbar fascia, it's the fascia that goes over the muscles there. Okay. The supraspinous ligament. That's your supraspinosus ligament, runs down the vertebral column. Trapezius muscle. The teres major. And the deltoid. Okay, we'll go another layer deeper here. And here's the top of the spleen, the bottom of the spinous capitis muscle we talked about before. There's just a tip of it right there, and it extends up. This is your rhomboid minor. Okay, and again, there's your rhomboid minor, and your rhomboid major is inferior to it. There's your rhomboid major. In rhomboid major, rhomboid minor. See how they connect? These different sizes. There's your deltoid. Your infraspinatus fascia, that's the white material there that connects the muscle, protects, overlays the muscle. There's your teres major, which is up on the side here. And there's the muscle on the right, on the left side. There's your erector spinae muscle. Latissimus dorsi, muscle along the entire side. And the external oblique muscle. Okay, this is your thoracocolumbar fascia. Serratus posterior inferior muscle. And serratus anterior muscles. And the external intercostal muscles between the ribs here. The scapula, the medial border of the scapula, blue line right here. Here's a medial border, the anterior border that comes up here on the top. The rhomboid major and rhomboid minor we talked about. You see the major and minor just above it. The scapula, there's the spine of the scapula. The supraspinatus muscle on top of the scapula. And the levator scapulae that extends up the side of the neck. Okay. I know there's a lot of muscles, a lot of attachment that it's just to the part of man, it's just pure memorization. You know, it's just, you just got to just remember the names and memorize each one. That's the only way to really learn them. All right. Again, the back muscles, there's your rhomboid minor and major. There's your rhomboid major right here. Your rhomboid minor just above it. Right there. Longissimus muscle. We saw that coming up from the neck. We're around the spinal column. The serratus anteriors on the side. The iliocostalis muscle. Spinalis muscle. Serratus posterior inferior muscles. Right there. And the supraspinosus ligament that comes down here. You see this ligament runs along the entire length of the spinal cord. That's your supraspinosus ligament. Thoracolumbar fascia. Can you see the fascia? It's the white material that goes over the muscles. It's a thoracolumbar fascia with the thorax and the lumbar. The external obliques. The erector spinae muscles. Branches the dorsal rami. Okay, that's the nerves you were talking about before, the rami of them. The rhomboid major we talked about, the scapula. That's the medial border of the scapula. And the levator scapular muscle of the neck. Bring that down. Okay, again, the splenius capitis muscle we saw from before. That's just the tip of it. Connects it to the neck. The supraspinatus muscle lies above the clavicles. The deltoid. The teres minor. And the teres major. Here's a teres minor. Now you can see there's a deep dissection of it here. There's a teres minor, just a little tip muscle right there. And the teres major is one that runs up below it right there. There's your teres major. The splenia cervicis comes up on the side of the neck again. The external intercostals. The iliocostalis muscle. And the iliac crest. This is the anterior part of the pelvic bone. Longissimus muscle runs along the spinal cord. Erector spinae runs along the side also there. And the spinalis muscle. This muscle as you go deeper and deeper during your dissection. You can see the scapula, the medial border of it. Can't really see the anterior border very well of that one. The teres major, again, here's your teres major. The teres minor is that tiny right above it. The infraspinatus. The scapula, that's the spine of the scapula. And the levator scapular muscle of the neck, you see the posterior portion of it. Yeah, do a little bit deeper dissection here. And this is C7. This is the process. The levator scapulae muscle, again, of the neck. Okay. The semispinalis cervicus muscle. The levator costera muscle, those are between the ribs. They come down across it. the serratus anterior muscles again, the external obliques, and the iliac crest of the hip bone of the pubic bone. Multifidus muscle goes up line from the buttocks on up on the sides of the spinal cord. You see L4. This is a transverse process to the side that comes out. Then you have the intertransversari muscle. Okay. You got rib number 9. You can see rib 10 below it, rib 11 from there, and all the different ribs. These are the external intercostal muscles of the ribs. The semispinalis thoracics muscle there, and you see rib number 2 as it comes off T2 up there. And one more deeper layer here. Okay. And here you can see the levator scapulae muscle again coming up from the neck. You see the levator costera muscles. These 3 ribs 9 through 12. Then you can see 11 and 12. 11 and 12 are free floating ribs. Rib number 9 is a false rib. You have the sacrum, okay, the superior articular process of it, and the filum terminale, which is the filum terminale is the end of the spinal cord. That's where the nerves end, and then they branch out from there. It's not the end of the vertebral column; it's the end of the spinal cord. Gluteus maximus and gluteus medius, 2 muscles of the buttocks. The major one's gluteus maximus and gluteus medius. The crest of the iliac. Okay, it's the anterior process. L4 is a transverse process. You have branches of the dorsal rami. Okay, those are your nerves. Those are branches. Talk about the ventral and dorsal nerve branches. There's a dura mater. Remember, the dura mater is which layer of the meninges? Remember, we talked about that last time?
The exterior layer, correct?
Yeah, the most exterior, the thicker, hardest layer, the outermost portion. You have the dura mater, arachnoid mater, and the pia mater. The pia mater is a thin, real like a saran wrap layer with the brain, the spinal cord. The arachnoid mater is a little bit thicker than that, and the dura mater is a real thick one that runs the outside of it. That's a protective layer. And then you have your the scapula. You see the medial border of your scapula, and this is the spine of the scapula, most anterior portion of it. All right, under the thorax. Look at the front section of the thorax. You see your deltoid muscle again. You see the cervical vein running just under the deltoid muscle, the serratus anteriors along the side, and the linea alba right down the middle. You have the rectus sheath that covers over the rectus abdominis muscles. That's that white sheath there. You have your external obliques, and you have your pectoralis major muscle. All right, so sternocleidomastoid, here's your attachment to the sternum and to the clavicle. You have your thoracoacromial artery. A little more right there. You have your deltoid. You have the cephalic vein. You have the medial pectoral nerve. And you have your pectoralis minor. Again, the pectoralis major has been removed. Pectoralis minor lies underneath it. And here's your pectoralis major right here on this side. If you take that off and dissect it away, there's your pectoralis minor underneath. The rectus abdominis, after the rectus abdominal sheath has been removed on this side. And then there's a rectus sheath on the other side. You have your external obliques, your serratus anteriors along the side, and your internal intercostals between the ribs. Again, we have saw the pectoralis major already. Okay. Taking a little bit deeper view on the anterior region, you can see the deltoid muscle. So you should all be familiar with the deltoid muscle by now. Be familiar with the pectoralis minor, pectoralis major, latissimus dorsi along the sides, serratus anteriors, internal intercostals between the ribs, external costals, more lateral to the internal intercostals. The internal intercostals are medial, more towards the midline of the external intercostal muscles. That's how you can tell them apart. You have ribs and costal cartilage. This is ribs 2 through 9. Pectoralis major, we saw the internal thoracic artery, the external obliques, and here's the rectus sheath, this white material right here, that lies over the rectus abdominis muscles. Okay, a little bit deeper, there's the anterior scalenes. Those are the muscles of the neck, the anterior, the middle, and the posterior scalenes. Okay, you can see the anterior scalenes here, right there. You see the pectoralis minor, it's cut away. This is just the superior tip of it. The posterior part's been cut away there. This is a primary bronchi of the lungs. Okay, those are the tubes of the lung. We haven't talked about the trachea. Comes down and branches into your bronchi. It feeds into the different lungs. This is the esophagus, where the food travels through. Again, the esophagus is deep to the trachea. The trachea runs on top of the esophagus. And when you do a cricothyroid membrane puncture, you puncture the trachea, you're not cutting through the esophagus. These are the innermost intercostal muscles after the dissection there. This is the diaphragm. Remember, the diaphragm is a mushroom. This is a huge mushroom that fits up here. And when the diaphragm contracts, it pulls down. So all the diaphragm does is pull down and increase the volume of the thoracic cavity. The lungs expand to fill that volume because nature doesn't like a void. So it expands to get the volume. The lungs get larger, pressure decreases. From the outside pressure, air flows in. The pressure differential. So that's the diaphragm muscle does. It's a big mushroom. Remember the tendon in the center, you can't miss the diaphragm. And underneath the diaphragm is the liver. That's a big organ right here. The pericardial sac is what surrounds the heart. These are your subcostal muscles, very deep to the intercostal muscles. This is aorta. Okay? The aorta goes from the heart, breaks down and passes as an arch, goes the aortic arch, then it goes to the thoracic aorta, goes through the diaphragm where it becomes the abdominal aorta. We'll get into all that as we get through it. That's the main artery off of the heart is the aorta. Latissimus dorsi, the muscles on the side, right here. You mouse to it. Okay. And then the deltoid muscle on the side. You see the deltoid muscle, which is one you should know. You can see the clavicle, which you should know. The pectoralis major, you should know. Serratus anteriors, you should know. And the external obliques. Those are all the side muscles that you should be familiar with by now. All right, again, deltoid muscle, pectoralis minor, which is when the pectoralis major has been dissected away. The medial pectoral nerve, the costal cartilages of ribs 1 through 5, serratus anteriors, and external obliques. How they interface with each other. Again, the serratus anteriors from the side, and the external obliques feed into those edges. The rectus abdominis muscles are covered by the rectus abdominis sheath. There's your pectoralis major from the side view. Your internal intercostal muscles, your external intercostal muscles. Again, internal is closer to the midline, closer to the sternum. Externals are further away from the sternum and the clavicle. The abdominal wall, you can see the rectus sheath, all this white area here covering the whole thing. You can see the inguinal ligament as it swings down over the pelvic girdle. The umbilicus, the linea alba, this means white line right down the center, and the external oblique muscles. We'll dissect that down. Second layer. You can see the linea alba, lying down the center, the rectus abdominis muscles, the internal obliques, and your inguinal ligament. The ilioinguinal nerve, the umbilicus, the rectus sheath, again, that's not dissected on the left-hand side, and the external oblique muscles. Anterior note, this is getting a little bit deeper now. The internal intercostal muscles, the ribs and the costal cartilages of 5 through 9. These are your internal oblique muscles. Okay. Your transverse abdominis. Those are the ones that where your rectus abdominis comes down, your transverse abdominis breaks it into sections. So you get your six-pack definition. Okay. This is your rectus abdominis muscle has been cut and reflected out of the way. The rectus abdominis, there's a reflection of it that's pulled up. There's the sheath, the posterior layer, and the anterior layer of the sheath. And the external oblique muscles. All right, this is the deepest dissection of the abdominal wall. You have the respiratory, you have the diaphragm. Remember, the diaphragm comes up, this big mushroom-shaped muscle with a tendon in the center. That's your diaphragm. The psoas major, the ureter. The ureter carries urine from the urinary bladder. It carries muscles from the kidney to the urinary bladder. Iliacus muscle, inguinal ligament. Again, you see the ligament really clear on this picture here. Iliopsoas muscle, and the femoral nerve. Okay, you got your external iliac artery and your femoral branch of the genitofemoral nerve. Okay, that's the real deep dissection. Okay, lateral view of the abdominal wall here on the outside. Again, your serratus anterior muscles. You can see on the top as they work from the side around. Latissimus dorsi are the very side muscles there. The external obliques, okay, meet up with the serratus anteriors. The linea alba, the umbilicus, and the rectus sheath. That's your anterior layer of the rectus sheath. Let's dissect that down a little further. And we get our serratus anterior still, which are these muscles right up in here. And then these are your external obliques adjacent to it. Latissimus dorsi are the muscles of the side. Your internal obliques. And your rectus abdominis muscles right there. This is the sheath, the anterior layer, and the linea alba is a line down the center. Okay, this is the back. Part of the back. And we got the supraspinous ligament. Because that runs down the spine. We got the deltoid muscle. We got the trapezius muscle. And we got the latissimus dorsi muscles. We have the rhomboid major and the teres major. Underneath those are the teres minor and the rhomboid minor. So here's your teres major, your rhomboid major, and your infraspinatus fascia, the white material protected going over the muscle there. And we'll dissect down. Okay, splenius capitis muscle. There's a very tip of that. It extends up the neck. The rhomboid minor. There's your rhomboid minor. There's your rhomboid major just below it. Trapezius muscle, deltoid, the infraspinatus, the supraspinatus ligament runs down the spinal column. I can get to highlight that. There you go. And latissimus dorsi, the muscles of the side. This is your erector spinae muscle. It goes on the sides of the spine. Your external intercostals. Serratus anterior muscles. The teres major, rhomboid major, supraspinatus. The levator scapulae. And that covers all those. Let's start here. The supraspinatus muscle. We're going to go above the deltoid, the rhomboid major, and above it, the rhomboid minor. There's the rhomboid minor right here above it. I can get it right on there. The infraspinatus muscle. Spinalis muscle. Runs right along the spinal cord. Iliocostalis muscle. Branch of the dorsal rami. Those are the nerves we talked about. And longissimus muscle. And we have our serratus anteriors, our erector spinae muscle, teres major, teres minor. And our levator scapular muscle going up the neck, and the rhomboid minor, rhomboid major. Splenius capitis, okay, muscles the neck that extend up. That's the very inferior tip of it, muscles. The supraspinatus, again, above the clavicles, deltoid muscle, teres minor, the spinalis muscle, and the external intercostals. And you have the iliocostalis muscle, your longissimus muscle, erector spinae, teres major, infraspinatus, levator scapula of the neck, and the splenus cervicus of the neck. Yeah, catch this up. There we go. All right, C7. So we're down right at the end of the cervical vertebrae and beginning of the thoracic vertebrae. That's the spinous process. You have your levator scapulae muscle on the side of the neck, your supraspinatus, your deltoid, your infraspinatus. There's a teres minor. There's a teres major. The semispinalis cervicus, levator costarum, serratus anteriors, and the multifidus muscle. You have your external intercostals, your semispinalis thoracics. You have rib number 2 up there, and then C7 spinous process again. And one more dissection later to go deeper in that. All right. Now we can see a bunch here on the nerve track here. So this is your levator scapulae muscle again. That extends up the neck. This is the dura mater. Remember, the dura mater is the outer sheath that is continuous with the brain, the skull, the inside lining of the skull, and down through the spinal column. It's the outer, thick, protective layer is the dura mater. Okay, then you got your external intercostal muscles, your levator costarum muscles between the ribs there. Branches of the dorsal rami. Those are your nerves that branch off the spinal column. Teres major, teres minor, infraspinatus. This is the spine of the scapula, the anterior portion of it. And then the supraspinatus, the muscle on top of the clavicle. And then you got your scapula. That's the medial border of the scapula. Right there. Okay, here's your anterior border of the scapula. And this is the medial border of the scapula. That line right there. Okay, the lower back, latissimus dorsi, muscles of the back come up the side. Your supraspinatus ligament, the gluteus medius, and the gluteus maximus. Gluteus medius is superior to the gluteus maximus. the crest of the iliac, thoracolumbar fascia goes over the muscles there, and the external oblique muscles to the side. Let's go a little bit deeper dissection there. Again, latissimus dorsi muscles, the external obliques, gluteus medius, gluteus maximus, thoracolumbar fascia. That's all the white material there that you see. And then serratus posterior inferior muscle. Okay, serratus posterior inferior muscle. Again, a little bit deeper cut through it. The external obliques, the crest of the iliac bone, gluteus medius, gluteus maximus, thoracolumbar fascia. Okay, a little bit deeper. The spinalis muscle goes right down the spine. External intercostal muscles, longissimus muscle, the iliac crest, and the iliocostalis muscle. Get your erector spinae muscle, and the branches of the dorsal rami. Those are the nerves that branch off the spinal column. Those are your dorsal rami, which we talked about. We did the nerves. Okay, levator costarum muscle. You can see right there the different muscles here between the ribs coming down. The external obliques and your iliac crest. Multifidus muscle. L4, this is getting near the bottom of the lumbar vertebrae. There's 5 lumbar vertebrae. That's the transverse process that runs to the side. Intertransversari muscle, down deep. The external intercostals, and that one is rib number 9. You can see rib 10, rib 11, and rib 12. All right, deep dissection here. The lower part of the back. So again, you see ribs 9 through 12. Ribs 9 through 12 are examples of false ribs. Ribs 11 and 12 are free-floating ribs. Ribs 1 through 7 are your true ribs. And you have your levator costarum. Okay, there's your ribs. So I'm going to highlight. There you go. Levator costarum muscle and the dura mater. It's right in the spinal cord, outer layer. L4, transverse process. And there's your sacrum, your superior articular process that stacks upon the L5 vertebrae. And the filum terminale, that is the end of the spinal cord. Not the end of the vertebral column, end of the spinal cord, end of the nerves. And then they branch down from there. Gluteus maximus, gluteus medius, the crest of the iliac bone, and branches of your dorsal rami, the branch of the nerves coming off the spinal column. Okay. Everybody's got all that memorized, right?
Sure.
Let's see how we do on our quiz. It should pop up here. There it is.
Really funny because your last.
All right, it lines up. What structure is highlighted?
Linea alba.
Yaba. White line. Perfect. Which muscle is highlighted?
The deltoid.
The deltoid. Very good. Is a deltoid responsible for abduction or adduction?
Abd.
ABD, abduction, away from the body. That's your deltoid. Because when you move on, you can feel that muscle contract. When you pull back, that's your pectoralis major. That's your adduction.
It's very confusing, and they should change it because whenever you're adding to the angle.
Right. They don't put a lot of thought into things sometimes. But add means to bring towards the midline, to add it back to your body. Ab means to move away. That's the best way to think about it. But yeah, you're right. It could have been a lot better, a lot clearer nomenclature. I guess we're stuck on number 2. I'll have to answer number 2 again. It doesn't like this, does it? Like that. There we go. All right. Which muscle is highlighted on the side there?
Serratus anterior.
Serratus anteriors. Yep. Good job. Which muscle is highlighted here? It's a deep dissection.
Spinatus.
The infraspinatus. Yep. Very good. Perfect. And what muscles are those?
Internal intercostal.
What was that? The levator costarum. Is that what you said? Everybody agree? Yep. Perfect. What muscle is highlighted here along the spinal cord? Anybody want to take a guess?
Semispinalis cervicis.
Cervicis?
There you go. That one.
That one. The semispinalis thoracis. That's more towards the middle. The cervicis is more towards the lateral border of it here. And they're dissected out. Like I said, those are really hard to understand those. Oh, we're having delays on our internet again. We skipped one. There we go. Which muscle is highlighted here?
Pectoralis minor.
Pectoralis minor.
Pectoralis minor is on the outside of the.
Yeah, pectoralis minor will be right here.
Right. Yeah.
This is coming up the neck.
So sternocleidomastoid.
Anterior scaling. Could be an anterior scaling too. It's really hard to tell because there's so much that's gone away from there. It could be the anterior scaling. It could be the sternocleidomastoid. I would say one of those. So we'll try the sternocleidomastoid. No, anterior scaling. We had a 50-50 chance we blew it. Like I said, it's a lot harder to tell when a lot has been dissected away. It really is. And this is trying to figure out the view on this one. Oh, this is a straight anterior view. Okay, this is the linea alba right here. It's coming straight up. So you're looking straight at it.
So it'd be internal oblique.
Internal oblique. Abdominis. Transverse abdominis. So that's your transverse abdominis right here. And what structure is highlighted here?
Be the rectus sheath.
Turn off the highlight. Yeah, if you turn off the highlight, you can see the white material there. That's that connective tissue covering over it as a rectus sheath. So that's your rectus sheath. What muscles are those? That looks like the same one we just had last time, right?
Levator costorum.
That's either the levator costorum or it's the internal intercostal muscles. It's hard to tell with where they're going. Maybe that's a little different. Maybe that's the internal intercostals. Let's guess that one. No, it was a levator costorum again. The same one. It was just hard to distinguish it. Didn't know it was the same one. All right. Again, and is that an anterior view? But view's hard to determine. Okay, that muscle right there, it extends all the way up.
External oblique.
If that's the side view, this would be here's your serratus anteriors. This would be the internal oblique. That could be that's not the rectus abdominis. It could be the external oblique. Is that what you said?
Yes.
Oh, rectus abdominis. That's a terrible view of it. Because it's pulled away. This muscle here is pulled off from here. This is flapped open. That's your rectus abdominis right there. It's not the highlighted area. The highlight's very misleading. This muscle here, like the quadrant right here, that's your rectus abdominis. The rest of it is just fascia, and that's been pulled down. So that's your rectus abdominis here. I would have just highlighted this little area right in here. That would have been rectus abdominis. And one else highlighted there on the side.
Serratus anterior.
Serratus anterior. Yep, perfect. What muscles highlighted there? Okay, looking at the back. Upper part of the back. Okay, the trapezoid's been cut away. So that could be I would
Teres
say
minor, teres major, or rhomboid major.
or the infraspinatus is in that area too. It's hard to tell what they've cut away here in this area. It's hard to tell what's been cut away on that because your rhomboid major, rhomboid minor is right here. Your teres major comes out to the side a little more. So hard to tell. What do you want to guess at?
Yes.
Teres major? No, infraspinatus. Because the infraspinatus is a triangular muscle that sits right here, but it's hard to tell how deep that cut is. So that one's pointing to infraspinatus. And what's that pointing to?
The esophagus.
Looks like the esophagus to me too. Yep, perfect. And let's turn the highlight on still.
It's the filum terminale. It's the end of the spinal cord.
At the very end of the spinal cord. Yep. Perfect. All right, that muscle right there.
Pectoralis minor.
That's what it looks like. Looks like the pectoralis major and cut away. That looks like the pectoralis minor. Yep. I don't think they'll argue with that one. There you go. When bilaterally contracted, what is the action of the highlighted muscle? Let me highlight it. Anteroreflexive, extends the vertebral column, laterally flexes the vertebral column, or elevates the rib cage. Bilateral contraction.
Extends the vertebral column.
Either extends or anteroreflexives. Let's try extends. Yep, extends the vertebral column. The pound pulls it back because it contracts the back end. It takes the superior head and the inferior head of it both contract, and on both sides. So it wouldn't be lateral. It'd be extension of the vertebral column. Perfect. All right. What is the primary function of the highlighted function? Now, we should know this one. What muscle is that pointing to?
Diaphragm.
Diaphragm. So what's this big funky thing right here?
The liver.
That's the liver. This is your diaphragm. What's the one purpose of the diaphragm?
Inspiration.
Okay, it's either inspiration or expiration. Remember what it does? It opens up. What's that?
I was going to say inspiration.
You're right. Exactly right. The reason for that is when that muscle contracts, it increases the size of the thoracic cavity, pulls down. Size increases, the lungs increase, the pressure decreases because there's more volume, air flows in. It's for inspiration. Perfect. And which structure of the humerus does the highlighted muscle insert? Okay, what's the highlighted muscle?
Pectoralis major.
Pectoralis major. Onto what surface of the humerus does the pectoralis major insert? It inserts on the head of the humerus, the deltoid tuberosity, the lesser tubercle, or the intertubercular groove. What's a good guess?
It's not the head because that goes into the joints.
The head, anybody else?
No, not the head. Not the head. Not the head.
Right.
It's not the head.
I was going to say the deltoids are tuberosity.
Deltoid tuberosity?
Just my guess, though.
The intertubercular groove is where the pectoralis major attaches to. We haven't covered that yet. And one more question. Which structure of the central nervous system is contained within the highlighted tissue?
Spinal cord.
First of all, what's
cord?
Yeah, what's the highlighted tissue? What is it highlighting? What's the outer layer of the spinal cord, the thick layer?
Dura mater.
Dura mater, okay? And what's inside of it would be the spinal cord. Perfect, correct.